So I'm going to focus a lot more heavily on the second half of my presentation, so I'm intentionally going to cruise through the first half a little bit. This foundation, though, this is Naturopathic Medicine 101. There is a time and a place for everything. There's no right or wrong. I'm not here to say there isn't a time and place for these things on top. Of course there is. But if the foundations aren't there, how are we going to heal? So I will be focusing more on that bottom quadrant. That is simply for a little oxytocin for y'all. When we see or experience or feel like the hug, when we feel and see those things, boom, you get a little oxytocin rush, which we all could use, right? Just like dopamine, feel-good hormones. So buy yourself a bouquet of flowers for no reason. Ask your partner to buy them for you. Give somebody a hug. So there is no, just like there's no magic cure to make the darkness go away, we can't magically exercise away a poor diet. We can't magically take the best supplements in the world that were most highly recommended if we're trying to resolve that emotional trauma. There is no amount of CBD or Xanax or GABA or anything that's going to resolve past trauma. Okay? We'll talk much more about that today. But if we are overindulging in certain things, exercise supplements may be great, but we need to address the cause. So nutrition, I am not going to talk about specific diet pieces because one, it's individualized. Two, I know it's already stressful. These are some general takeaways that we could all benefit from. So our bodies were not designed to go through drive-thrus and eat processed food. We were designed to find the food, make the food, think about the food, smell the food. In that process, phase 1 of digestion begins. That phase 1 starts way up here. Our salivary amylase kicks in. Hydrochloric acid is functioning, going, oh, it's almost time to eat. I'm getting a little hungry. This is good. Let's do this. Parasympathetic nervous system. I'm guessing you've all heard of sympathetic, parasympathetic, yes. If not, parasympathetic is our rest, digest, heal nervous system. We want that on board when we're eating, or ideally before, during, as much of our day as we can. And so when we take deep breaths, when we sit in gratitude, when we prepare versus just opening a package, shoving it in our mouth, rush, I'm on a work phone call, gotta go. Then it gets down here in our intestines and these critters have to take over. So we're going to have more gas and bloating, indigestion, those sorts of things, toxemia. Food intolerances I focus on very heavily in practice. For the sake of today, I'm not. But it's basically finding out your genetic enzymatic inability to break down certain foods or food groups. So years ago, I thought eggs and veggies were a great breakfast for me, healthy. And then I realized once I got my results, I am intolerant to egg, fruit, sugar combo. If I avoid eggs and sugar, my symptoms are not there. So this is very specific for each individual. Just takes a few drops of blood and the results we can follow the rest of our life, ideally, because what happens when we eat our food intolerances is if we don't have the enzymes to break them down, it creates toxemia, garbage rotting in our intestines, which obviously we don't want, especially with the close proximity of where our appendix would be, right? And then sugar, I know it can taste so good. It gives you a dopamine rush. It's fun. It's a treat, right? And it's also poison. I can't sugarcoat it, no pun intended. This does not include things like fruit, maple syrup, honey. Some people do fine with erythritol, stevia. I am not judging. If you are eating sugar at this moment, I am not judging. I am simply here saying, and I'm human as well, not busted. We're not judging. But it's more cancer promoting, and it's not good for any of us. All of us can benefit from avoiding sugar. And then when given the chance, we want to choose the rainbow versus the pale, pasty white foods. Choose the vibrant colors, the purples, oranges, reds. And then also when given the option, choose local. Fresh is always going to be better than processed or frozen. And then it gets to be a little more expensive. So for organic, I say stick to the dirty dozen. There's a EWG, it's called Environmental Working Group. There's a dirty dozen, which you want to buy organic, or I recommend patients to buy organic. And then there's those that are the cleaner 15. So things like spinach, those sorts of things. And then grass-fed, grass-finished, wild, free-range, etc. So these may be some items that you are all familiar with, or maybe some of them you're familiar with. We've got glutamine, probiotics, ginger, I saw ginger on the table, medicinal mushrooms, and melatonin. So like I said, I'm not going to focus too heavily on this because one or more may be contraindicated for you. But when I was trying to think what gives the greatest benefit with little to no risk, this is what I came up with for specific population who is here today. So glutamine, it's like the Pepto-Bismol commercial in action of what it does to our digestive tract, but it's nothing like Pepto-Bismol. It does so much more than that. I'm going to keep it simple and leave it there, often in a powder, so that can coat and soothe the digestive tract. Probiotics you're all familiar with. If somebody's been on antibiotics, these are critical. I describe a lot of things as teeter-totters and tug-of-wars. We want more of the good guys in our digestive tract than the quote bad guys. We have, I hate to label good and bad, but we have the bad guys in here, but we want to overpopulate the good guys. So that's the point of probiotics, one of many. Ginger, you're all familiar with, I'm sure. If not, you're getting familiar. Great for digestion, especially nausea, but also internal. If you have a lack of internal heat, cold hands and feet, you get chilled easily, ginger could be your friend because it is warming, it's stimulating, it helps with circulation. And then medicinal mushrooms, especially turkey tail. A lot of different ways to get those in your diet or supplement. And then melatonin, not because everyone with any type of cancer or this specific type of cancer has sleep issues, but there's a good chance, but more so for the antioxidant benefit. Sleep issues, we may go as low as 0.3 milligrams. If I am working with somebody with any type of cancer, really, I'm going to go more like 20 milligrams. But talk to your practitioners. So the one on the left, I understand, is not a very flattering picture. This is how my brain describes to patients what toxicity is. And I equate it to garbage buckets and conveyor belts. If we are pouring more in those garbage buckets and not taking them out frequently, things are going to overaccumulate. This could look like anxiety, weight gain, hypertension, insomnia, skin issues. It doesn't matter. Whatever it is for that person is an overabundance of toxicity. So by pouring less in, this can be as simple as how you talk to yourself, who you surround yourself with. In the kitchen, not putting heated items in plastics, choosing to drink out of glass, stainless steel, or copper instead, because things can leach into the plastic, and we don't want that in our system. Simple things at home, you can choose unscented, free and clear. What we put on our skin matters. You know, I hope, but I'm going to say it, there is no one reason that you get cancer. If somebody says there is, I think we all know they're lying. It is different for every person, and it is, in essence, a pie chart or a puzzle. There's so many different variables, so please, if anybody is hung up or beating them, that was that one thing, or I did this, or I didn't do this, please work on letting that go, because that is only contributing to pouring more in your garbage bucket, which we don't want. So that tug of war, we want to move things along. So how can we do that? We can do that by loving on our detox pathways. We have got a few of them, luckily. We have our lymphatic system. We have our lungs. So breathing can be very important. If we're holding our breath, keeping everything in, that's exactly what happens. Lungs are a detox pathway. Our kidneys, so making sure to drink enough hydration, moving things along. If a patient tells me they pee maybe like once every 4 hours, that's a concern. We need to get things moving, more hydration. And then, of course, intestines. We want things to be moving along in that area. I've had patients, I think our record was they had a bowel movement once every 10 days. I know. Amazing, right? So think of all of that recirculating toxicant stuff hanging out. So we want to be sweating. Our skin is a detox organ, which is why we don't want to I'm going to pick on Bath and Body for a second. Sorry if there's any lovers, but none of us need Bath and Body. Plenty of toxicity. And then we put it right on our skin, right? After a warm shower where our pores are open. So sweating, getting crap out instead of adding more onto our skin. All of those things can be helpful. Lymphatic. My mom passed from breast cancer. I am not going down that journey, and I want to do everything in my power to put all of the things in the plus category that I can. Take away as many of the negative in that tug of war. So I have this, I've had them since I was young, but the little rebounders, like little trampolines, put in front of the TV, bounce, and that's amazing for your lymph. If that is too aggressive or that's not your jam, things like rocking. Babies, side note, I just think it's cool because the body's cool, but babies don't have a developed lymphatic system yet. And think of how well designed that was. How we rock babies, right? Loving on their lymphatic system. So rocking, moving, if you're flying, even just moving your feet up and down, preventing those blood clots or stagnation. Whole body vibration, I love mine, use it all the time. It's a little more aggressive. Swimming, dry brushing, massage, all great things to love on your lymphatic system.
What's whole body vibration?
It is a plate or a plate with some handlebars, and it literally vibrates. So there's so much research. I've done videos. I'm really passionate. We can chat after. But it is great for moving the lymph and building bone density. And you can't be crabby standing on something that's like jiggling. So it's fun too. And then mental, emotional, we are going to focus on more today. But there's lots of ways. I'm very biased because my life, I don't have time to share my story, but this wouldn't be happening right now. Let me just say that. I couldn't speak in front of people. I was unlovable. I was an absolute mess, zero confidence. Bad news, lots of issues. And because of this work, I'm able to speak, be very real, that I am so far from imperfect, and I'm so okay with it now, finally. Thank God. So we can release through lots of things. Prayer, movement, breath work, talking with a trusted friend or partner, subconscious techniques we're going to talk a little bit about today. And if this is stressing you out in the least or in life when you're like, oh my gosh, this person's telling me to do this, and then I read this, and then I heard this podcast, pause and take a breath and go, okay, I only have so much time in the day. I only have so much energy. I only have so much money, resources, etc. I have this many appointments, this much stuff. Am I doing my best? And the answer is probably yes. You can't do more than your best, right? Can't do better than our best. So really check in with yourself, even if everyone around you is telling you should do this, you shouldn't do that. You're getting conflicting info. You know what's best for you. You know your body better than anyone else. So do what you can with what you have and where you are and surrender to the rest. Surrender and accept. So let's do one of these techniques together. Raise your hand if you have ever heard of emotional freedom technique, also known as tapping or EFT. Yeah. Okay, good. Are you, keep your hand up if you're a fan or have noticed any benefit. And raise, okay. So I want that nearly everything I do in practice right now, I was the biggest pain in the butt patient, and I was the biggest skeptic to all of it. And here I am. Because it changed my life, I couldn't deny these things. So EFT was another one. And it wasn't until a few years ago that I was at a conference and they just real quickly talked about EFT. We did it with each other and I was like, son of a gun, once again, I need to get out of my own way. I'm not that smart and my body is, and all of our bodies are, so just get out of your way, Shawna. So I did, and now I have a free YouTube video. There's plenty of free resources that you can find this. But I want to do it together today because the best way to solidify info is to do it, especially for us kinesthetic learners. So I'm going to put the mic down. So think of a stressful event. It might be your belly's out.
It may be you just made a phone call and it was a stressful conversation. It might be you didn't sleep well last night. We're just feeling really sluggish. Whatever it is, tune in, check in with your body, and what's that stressor. And then rate it. 10 is in awful, I'm not 10, I just attack. This is the worst thing out of it. 0 is I'm chill on a beach, happy, content. So rate it. Let's see this for you. And then we're going to do this together. It's up there, but just go ahead and follow along. If those of you who've done this, if it's different, it's okay. There are many different ways to do this. Not one is right, not one is wrong. Mine is definitely not right, but I can tell you that it works. So go ahead and find that stressor. Did you choose a number 0 to 10 just for you? Awesome. Here we go. So you're going to take 2 to 3 finger pads, and put them out the ear above the inner eye. So I'll go over here and over here. And just tap a few times, making of that stressor or stress there of that. And then we're going to go on the outside of our eyebrow, little indentation over here. And just keep breathing, thinking of that stress. You might narrow it down to a word. Keep breathing and go to the upper cheek. Keep breathing, thinking of that stressful event or stressed feeling. And then this fifth one, go between your nose and your upper lip. Breathing, stressful feeling, happy. Below the chin, below the lip, above the chin. Breathing. Then going to go below your clavicle next to your sternum. So not right on the bone, but a little bit softer area of tapping, breathing, feeling. The next one is either a chicken wing or a hug. The chicken wing looks like this. The hug looks like this. They're the same, separate. You just find one that you like, tapping, breathing. They're welcome to still as your eyes through this next one, as this is the last one. You're going to find between your fourth and fifth bones here. You can either rest it. I'm going to do it here so you can see you, but you don't have to do it this way. And you're just going to tap on that area. Just tapping there, leaving stressful events. And then as you're tapping, close your eyes. Keep tapping, same feeling, keep breathing, and then open your eyes and just with your eyes look down to the left. Tapping, and then your eyes lay down to the right. And then do a big eye roll or eye circle in one direction. And then the other direction. A big eye roll, eye circle, keep tapping, feeling. Then we're all going to hover to yourself out. And then we're going to count to 5 out loud.
2, 3, 4.
And go ahead and just check in with your body. You can close your eyes and think about whatever you were thinking of, stressed about, feeling. And rate that again. 0 to 10. And raise your hand if that number came down at all. Good. Good. That's very typical. You can do it again. We're not going to for the sake of time. And you can do it all over again. The whole day until you get it to where it's more manageable. This would be a great time to do if you're going into a stressful appointment, imaging, conversation. It can be very effective, even if you just streamline it, shorten it. You can even go, okay, I got 10 seconds. I'm just going here. And then I'm going to move my eyes out. I remember what she said, but maybe we call it, it's activating your color. It's doing a lot. We don't need to get into the science, but it can be very effective. It's food. It would be great for children. So that is EFT.
All right. So my neighbors have a lemon tree. So once in a while I get to enjoy the lemons. And let's just say I picked a lemon. I went in my kitchen, sliced it open, the zest and the juice is going everywhere. I'm smelling the lemon. Eventually I cut it into quarters. I put it in my mouth and I squeeze that juicy lemon. Is anybody starting to salivate even a little bit? Yes. You are not delusional. You are not crazy. This is, we could call it muscle memory, but it's more of a physiological response because at one time in your life, you've experienced what a lemon is and your body remembers that. The same thing happens emotionally, which can be a bummer because usually the good stuff we don't think about, that smell that reminds you of grandma's house, that gives you the warm feeling in your heart. that we don't want to negate that. It's the stuff where it's like, why can I not get over that? Why does that trigger me? Why does that bother me? And you can try to talk sense to yourself all day long, like, it's not a big deal. They didn't mean it, but it's still getting you. Your body feels the stressor. That's subconscious. That's where I focus, and it's 95% of our operating, and I like fast results. So this is just an example of one of the techniques that we're going to talk about today, NET, neuro-emotional technique, how and why those stressors get stuck in our body, and then things happen later in life and trigger them, and we feel how we did back then. So I love results with patients, but I don't need a double-blind placebo-controlled study to show me that it works. I see it. I witness it. But I think this study is cool, so I'm going to share it with you. And when I was such a skeptic, my brain needed some things like this. So this is a functional MRI study. The study was done on people with cancer. They wrote down the worst part of their journey. Simple paragraph, 1 to 2 paragraphs. And it was the worst. It was triggering. It was traumatic. I usually give an example to patients. I'm not going to today. You have your own worst thing. And that is forever etched, unfortunately. So they read back that paragraph to these patients. Then they measured subjective and objective findings. How do you feel? Perspiration, heart rate, blood pressure, and much more. And then they put them in a functional MRI. And on the left side, that is, you don't need to know what part of the brain, but it's next to the hippocampus. It's called parahippocampal region. And it lit up with stress. Fascinating, right? So yeah, our brain lights up with stress, but how you may feel it is, I have sweaty palms, my heart's racing, I have this pit in my stomach, lump in my throat. Whatever it is your stressor. It doesn't matter. It's individualized. The goal is to reduce that. So the functional MRI on the right is after neuro-emotional technique, or NET. They read back the exact same paragraph, exact same stressor. The brain completely changed. 80% of our nervous system is above our spine, cranium, brain, etc. So that is powerful. And this wasn't after 6 months and 60 treatments. This was after 1 to 4 treatments with patients. So it's very powerful. Subconscious is 95% of our operating system. That is wild. Everything that is a habit, a value, a thought, an autopilot, that's your subconscious. This is, I don't like to attribute fault or blame. In essence, this is basically our upbringing and the experiences that we have been through, what we've been told, what we tell ourselves, and those underlying beliefs. So they do not change overnight or through conscious talk therapy. Not bashing talk therapy, but we cannot use that 5% conscious to change the 95% subconscious. We have to go in the side door, I call it, to find something different to change those underlying things. And it doesn't matter if you tell yourself, it's okay, I know, it's not a big deal, get over it, but you're not getting over it. That's subconscious. So our conscious is great. Logic, reasoning, mathematical problems, we need it. Our subconscious is out to keep us safe. So it's not trying to be excuse my language, it's not trying. It is out to keep you safe. So if it remembers an event where it did not feel safe, it's going to do everything in its power to say, don't do it, don't do it, don't do it. Stay out of that situation, even if it's not a harmful situation. The feeling is what matters. So a lot of people, I wrote these examples down. Cold plunges, anybody familiar? Yeah. I've been a big fan over the years, but I just listen to my body when it's not the right time. Anybody who does their first cold plunge, the body says, get out now. You are going to die. This is awful. Get your butt out. There can be benefits depending on the person, how you're doing it. So that's just one example. It's not lying to you. It's true. But we can compensate with the conscious to go, it's okay. We got this. So I hate to be the bearer of bad news if you don't know already. Unprocessed emotion affects our health. I did not say it affects our emotional health. It affects our health. I have seen those symptoms on the bottom and so much more resolve completely with these mental emotional techniques. It even blows my mind. We're talking patients with 52 years of migraines. And it's not the diet that did it. It was the mental emotional. So I just want to share a few stories here. It's okay if your brain goes, woo, woo, woo. It's okay. I understand. I was there at one point. And then I kept seeing this healing. And I'm like, I can't deny this. So I just picked a few patient testimonies or stories rather that I think were really cool. So this patient was diagnosed with fibromyalgia only about a year ago. This was many years ago. So from my memory, it was about a year. The faster we address an issue, the less stuff that's piled on, whether it's time, medication, etc., the faster people can heal. So within a year, that was great. After an hour and a half, my first appointment intake is 2 hours. After about an hour and a half, it was very clear to me that we weren't going to see these impressive results with diet, toxicity, some of these other things. Hers, I trusted that it was solely related to mental emotional. Usually it's not one cause, but with her, I was really confident with that. And I paused and I said, are you okay if we don't continue and if we jump right to treatment today? And she asked a little more, and I shared what applied kinesiology was, which this is, gets interesting, but we're getting information from the body, muscle testing, etc., which I was very anti and skeptical about at one time in my life. And she said, well, I'm in too much pain. I can't do that. So we used her husband, who was with, as a surrogate. So can I touch you? So let's say I was her husband. She was the patient. I'm over here. I would simply touch her, would go towards her, and we're using my arm as the test arm. So it's very unique. Yes. So we proceeded, and I believe the statement I used was along the line. It was along the lines. I don't remember the exact statement, but either my body and I can be okay without fibromyalgia, or my body and I are ready to be without pain. It was something along those lines. And, I should back up. Her fibromyalgia symptoms started after she was in a car accident. She was driving. Her parents were in the car, older parents. And her symptoms flared. And I forgot to also tell you, she'd done all of the physical things, the chiropractic massage, acupuncture, like she did it all, the supplements, the medications, the injections, nothing was helping. So what came up, and explaining a little bit about NET, we find the stressor, the issue, we find the emotion, we find the worst thing, which I'll explain more in a minute, and then we go back to when that original event was stored in your body, kind of like the first time you had a lemon. So my body and I can be okay without pain. Weak. Okay, what's the emotion? Shame. Feeling bad or shame. It's the number one emotion I see come up with people. If anybody is familiar with Brene Brown, shame is rampant in our society, guessing the world, definitely our society. So we've got shame. I kept going, what's the worst thing? What's the worst thing? She said, I feel like it's my fault. Something's my fault. Okay, well, let's ask the body, the original event where there was shame, something felt like your fault. And 5 years old came up. She was now in her 50s. 5 years old came up, and she immediately got this visceral emotional reaction. I could see her eyes get glossy. And usually I narrow down the category for people like family, friends, blah, blah, blah. And she goes, I know what it is. She goes, I thought that was in a vault forever. And I've heard that before. I'm like, And she started crying. And she was molested by her uncle. And I've worked with so many people with abuse, especially sexual abuse, and it just pisses me off that unfortunately the way their body stores it is that it's their fault. Everyone. I've never worked with somebody that their body didn't store it as it was their fault. And it's not. We consciously know that. But I've seen it again and again. And so her body was storing this stressor, this 5-year-old innocent little girl, her fault. And then when that stress was that vault, she called it, was open, she felt like it was her fault that she got in the car accident and her parents were in the car and everyone got injured. And her fibromyalgia began. Wild, right? so we finish. She goes into position, which we'll do in a second. She sits up, and I have seen miracles, but I've learned to never expect. The body's the boss. I'm just along for the ride. And so she sat up, and I said, how do you feel? She goes, I feel really calm and relaxed, and that's typical. And I said, okay, like, how does your body feel? And she said, the pain is gone. Okay, well, move around a little more, kind of tweak it a little more. She said, no, I feel no pain. And her husband, me, we were all teary already, but we got choked up. And her pain has not come back. Her fibromyalgia was resolved by addressing the stored trauma from an event at 5 years old. Right? I can see how many would think that's woo and impossible, but I see this with my own eyes. So the body's powerful. We don't want to store emotion. And keep in mind, by store emotion, it's not often. Often it is something different than the divorce, the death, the known trauma, the rape. Those things, sometimes we process a bit more because they are so heavy. We need someone to talk to. We need to cry. It's the things that we're like, it's fine. You shouldn't be stressed about that. Well, what if I did feel bad that I never got asked to prom? What if I did feel bad that so-and-so broke my heart, or that a perfectionist got a B on that one exam? It's fine. It's stupid. Don't tell anybody. Just shut up. You're fine. That's how we get stored trauma. So I encourage you to be real, feel it, and do things to process versus shutting it down and telling yourself, oh, you're fine. It's stupid. You should get over that. No. Feelings are normal. So I want to share this other one. This patient I had been working with for some other concerns. She was doing great. And then she said, oh, I cannot get over it. Like, it's really affecting my relationship with my husband. I am so concerned about his health. He is not investing in taking care of his health, and it's affecting me negatively. And okay, I understand. And so we were working on it. And what came up for her was the feeling was anger. The worst thing was feeling like something was unfair. And I've known this patient for a while. She is Jewish, and I get a lot of intuitive hits, I call them, but I have to keep my mouth shut because it's all about the patient and it's not about me. And so I was getting these hits as we continued, and anger, unfair, and it went to a worry about after death. And I said, what are your beliefs? Like, what happens to your body after death? What do you want to, like, what are your thoughts? And she said, well, I'm Jewish, so the only option is burial. I said, okay, let's check. Nope. Body said, no, thanks. Try again. I said, what else? What else could there be? She's like, that's it. There are no other options. And then that's when I got that hit. And it was check cremation. And I said, well, anything, like, would you ever consider anything else? Nope. Burial or nothing. I said, can I check something? And she said, yeah, that's fine. So I checked a few things, included cremation, and her arm went weak. And I said, how can you make sense of anger, unfair, cremation after death? And she said, well, I do have ancestors that were in the Holocaust. Yeah, definitely did not have a dry eye. I said, can you see how your body has stored that generational trauma and is pissed off and would find it incredibly unfair if your body was burned against your wishes after death? She said, yep. She processed and released that generational trauma from her body. And does she love her husband? Does she want him to invest in his health? Does she care? Yes, but it's not destroying or consuming her anymore. So it's not always things. I know that sounds really deep and woo, but there is such a thing as generational trauma. Whether it is our parents, our culture, there is stuff that our DNA carries. And that is just not my belief. There is actual research surrounding that. Neuropathy, swelling, and lower leg pain for 40 years. I won't get into the full, like I did with these other two, but it was a stressor in her body. She was able to sit up minutes later, and she started crying. I said, what's going on? What's coming up? She said, it's gone. Like, how is it? This can't be. Like, she was really doubting. And I said, yes, that is the power of our emotions. So please do not judge the power or minimize the power that our emotional health has on our overall health. Now, I'm biased. The first two are the ones, first three, I guess, are the ones that I do in office with patients. These are not the end-all be-all. There are so many ways to shift your subconscious, including what is on this slide and the next slide. So many. And there's many more that I didn't even write down. So depending on where you live, there's different resources online. One more sec. There's some more. So let's do what I call a speed NET, or neuro-emotional technique. This is not as specific, or I'll be honest, I don't find it as powerful as the in-person when you're working with a practitioner and you're being very specific. But guess what? It's free and you can do it at home or anytime. I have done this. I've done NET on airplanes, in Hawaii when somebody was having a panic attack at the edge of the waterfall, on the phone. Like, there's many ways you can do it, but this, you can do it without knowing nothing about the training, okay? So what you're going to do is find either the same or a different stressful feeling or event, and find that, and then really tune in instead of shutting down, like, nope, don't want to feel it. Tune into that stress, feel that emotion, and then ask yourself, who cares? Why does this bother me? What's the worst thing? And because this can be kind of tricky if you've never done this exercise, if anybody's willing to be vulnerable, and I can help you find the worst. Thank you. So are you willing to share your stressor?
Sure. You want a cancer-related one or a non-cancer related one?
I want you to choose.
Okay. All right. I'll give you a cancer-related one. Okay. So what's the question?
A stressful feeling or event.
My biggest fear is that I'm going to get brain metastasis. And it's going to affect my intelligence. I'm a college student. I wanted to be a doctor. I still might go to medical school if I could play it. But it matters to me a lot that my mind is intact and as sharp as ever. It was my biggest fear that chemo brain would completely destroy my ability to process and do math and do science and remember everything.
Yes. So that feeling, in office, we would let your body tell me the feeling, but I want you to access, like, check in and go, what is that feeling?
It's fear.
Fear. So we've got fear. And then what's the worst thing? If things were ever to metastasize and affect your brain, what would be bad for you?
The worst thing that could happen probably is that it didn't metastasize to my brain, and then I would end up like with personality shifts like that I can't explain. Those personality shifts would like destroy my relationships because I can't explain them and nobody else will be able to understand me, because who else? I'm 19. I was diagnosed stage 4, like off the bat, pretty much. It was like, quote unquote, it was over for me before it became notes. But like at the time, that's how I felt when I got diagnosed, because I was 18 and I was like, my life just began. I just got my freedom and all of a sudden I'm getting kicked out.
Right. So what's the worst thing about everything you just said? If you were to put it in just a few words or a sentence, like the worst thing about all of that.
I would never be able to live up to all of my potential.
And if you can't live up to your potential, what's bad about that? If your potential's here and you feel like you'd be here, what is that?
It would make me very disappointed in myself.
Exactly. So usually if she's in office, like I see a lot of themes, likely it's either failure or disappointment in yourself. So for you, you would think of fear and either disappointing yourself or others or failure. That would be hers. Does this make sense? Okay. So find yours, the emotion, the worst thing, and whittle it down. And I'll give you an example, non-cancer related. So I'm just going to make this up. We'll see what comes out of my mouth. Let's say I'm driving and I feel stressed and I turn into this beast and I get really volatile and it's like, what is this? This is not me. Like, why am I so stressed out and anxious? Okay. What's the worst? What am I feeling? I can't even access it. It's just stress, anxiety. Okay. What's the worst thing? Well, those jerks, that guy cut me off. And no. What's the worst thing for me? So if you find yourself finding something else outside of you, go, no. What's the worst thing for me? Okay, if that jerk cuts me off, and if this, well, I could be late, or I could get in an accident. Okay, well, what's bad about that? Well, I feel unsafe. Yes. So that is likely the lowest common denominator. When you feel unsafe, your nervous system is triggered. So for me, it would be that unsafe feeling is what I would access. Okay. Does this make sense? Enough? Okay. So find your emotion.
Worse. And then this is where it counts. So in office, we find the specific point. But for you, I want you to take the palms out in front of you. Bring one under the other. Wrap your first finger at the lower thumb pad, and then line the rest up. So it looks like, yeah. Then you take your available palm and put it on your forehead. Then, if it's comfortable, some people put their elbows on their knees. Some just relax their upper body, their head, their neck. So whatever's comfortable to you and just you believe it. Think of that welcome forward sting, that feeling, and just take some breaths. And then you can release your hands and do the opposite. This, you're not doing office, but we're going to cover all the points. So whatever you just did, switch the hands, same spots, just opposite side. And then your palm goes across your forehead, and then comfortably drop into that, breathe deeply, thinking of that worst thing, let your body feel. One more big breath and release.
So did anybody notice a lessening? Kind of like that we did the before and after with EFT. Yeah, hopefully nobody's worse. I've never seen that in office, but may that not be the case. So that's free, easy. You can do it at home. They've done research on this with children in schools and found it to be very effective. So it's not just with kids, not just us in this room, anybody. So this is not mine. I got this from a spiritual psychologist that I work with. And so simple. I could be doing this up here and none of you would know. What you do is, it doesn't matter which hand. You can do either or both. So you're going to take your middle finger and your thumb and just take your thumb in that inner web of the middle finger. Right there. And go as close to the web as you can. And push into right here. There you go. And you're not pushing, leaving nail marks, and you're not just barely pressing, but firm pressure. And that is a hand position that you can use anytime. You can do this driving. You can do it on both. I'm obviously holding it.
I love your understanding.
So you can do this at any time. Nobody really needs to know. So you're going to want to go right in there. So with the thumb. All right. So simple. Anytime, if you're feeling anxiety, that would be a good one to do. How many have experienced acupuncture? Okay, nice. So that is just a little cartoon about potentially early acupuncture. If you can see the spears in his hinder. So when I'm working with patients, everything I'm doing is addressing overall health, addressing the cause. For the sake of today, I'm going to talk more about symptomatic relief, which is not what I do, and it's very hard for my brain, but it's okay. I'll get over it. So with acupuncture, we're looking to balance overall, boost deficiencies, and help the things that are excess to chill out. We want to balance the yin-yang, faster recovery. But some of these symptoms that can be relieved with acupuncture are what you see here. There's so much more than that, but those are just a few. So helping with sleep, anxiety, nausea, hot flashes, so much more. Pain, often the second the patient gets off the table, I would say 80 to 85% notice less pain. I have maybe 10 to 15% who by the time they get in their car or drive home, then they notice. But it can be incredibly effective, has even been shown to be as effective as the heavy hitting pain meds, which blows my mind. I love it. beauty for all of us is that it is non-addictive. It does not interact with or is contraindicated with what else you are doing, any of it. I can't think of one thing. Perhaps there is, but right now I can't think of one thing. Obviously, you wouldn't put it, if you have an open lesion that's infected, you're not going to put a needle in there. Common sense. But it's non-addictive, no side effects or contraindications. So I want to share with you some points that you can do on yourself, not necessarily with a needle, but I brought some, we're not going to do this. I just wanted to show you. These are ear seeds. You can look at them after if you'd like. You can see a practitioner who uses needles. I had a needle phobia that NET resolved. And I also, these don't even count as needles. They're so fine, but it was a brain thing for me. And so I had to get over that. And it's not painful. It shouldn't be painful, but it's a needle going in your skin. So it's very gentle, very tiny needle. Another option would be the ear seeds, which I have here. The C-bands, which is pictured up here. That's a brand, but I still call them C-bands. Or you can even get creative at home and use either, I can't see her name tape, but she's got a crystal gem necklace. She could even tape one of those, or if somebody has a bracelet, tape that to certain areas. Apply pressure or a marble, a smooth rock, get creative. Any way and then of course acupressure, which we're going to do today. So there are hundreds of spots in the ear. It takes a lot of training to learn all of them. You don't have to. This is just kind of some of the top ones. If I'm working with anybody helping them resolve addictions, we're going to focus on various ear points. So pericardium 6 is one that I want all of you to be familiar with. This is one that I got familiar with even before I'd even heard of acupuncture. When I was a kid in Minnesota and had motion sickness, I did the things, the drying mouth and the sleeping meds and the patches. And then I learned of C-bands. And there was no side effects and no issues. So I loved them. And then now I know why. So pericardium 6 is amazing for nausea. And unfortunately, it's not necessarily curative, but it's okay because, you can do this multiple times. So it's also good for those other things mentioned, but pericardium is the outer membrane of the heart. So obviously things in this region, whether it's palpitations or chest congestion, can also be good for. But I think of it most for calming the Shen, helping people to sleep, great for nausea and vomiting. So I'm going to put this
and talk about, can you hear me okay? Good? Okay. So pericardium 6 is the width of your thumb is called 1 Cu, C-U-N, Italian medicine. So not my thumb, but your thumb because it's your body. So you're going to take the width of your thumb and find your wrist crease and take 1 thumb width, 2 thumb widths. That is where the point will be, and then it's between the 2 tendons. So if you make a fist this way, you feel those tendons. If anybody's struggling, raise your hand, I'll confine it on you. So that's pericardium 6. So mine would be 2 thumb widths, 1, 2, though that's my pericardium 6. So then you would either place that, tape a marble, just push between those tendons, or the C-bands, or if you're getting acupuncture, a needle. That is it. There's no right or wrong way to push. You obviously don't want to push so hard that you're giving yourself, numbness in your hand. But firm pressure, you can do firm pressure continuously. You can push a little and then not. I've also used this one in Hawaii. On that trip, they told us, the guide was like, we never have issues on that trip. In an hour, there was 2 emergencies. And I used this one because this woman had broken her arm. She was in a total panic. She had vomited. She felt awful. And so I taught her husband, just press firmly here until obviously help arrives. I was not the help. And it can help with nausea. So that is one. The C-bands, they're very cheap. You can get a multi-pack. I have a ton all over my office. And cheap and effective. So that's pericardium 6. LI4 or large intestine 4.
Any pain in this region, anywhere in the body, but especially the head and face, LI4 can be amazing for. So this spot can also help with GI distress, which is why I included this point. You don't want to use this one during pregnancy because it can promote labor. So if you're overdue, great point to use.
And it can work. So if
go like this, you see that little mound right here? Little mound. Another way you can find it is
to find where the bones connect. It's not there. And it's not at the skin part of your leg. It's in between. It's tender. It's like a Herzog tendon. So it's a little closer to the junction of the bones than it is the web, but you're there. If you're anything here and there, you found out like what? Tender, a little bit, something full. So same thing. You can push it firmly. You don't want to crank on it, but push till you feel a little sensation.
And that's one that maybe you could have somebody else do. So whether you're watching TV on a flight, somebody else can grab that, or you can alternate, hold one, and then do the other. That is LI4. That's another one that you could take something round like a marble, a gem, something like that, and just tape it firmly to that area. Liver 3 is very similar to LI4 in the location, but it's between your first and second toes. So it's not right where the bones connect, and it's not right where this looser skin web is, but somewhat in between. That one is amazing for high blood pressure or anger, but it's also great for things like insomnia, pain, abdominal distension. This connected with the last one we did, LI4, is called the 4 gates in Chinese medicine. It opens things up and helps things flow. So in Chinese medicine, pain is equated to stagnation, or I should say the opposite. Stagnation equals pain. So we don't want to be stagnant emotionally, physically, spiritually, anything. So this helps to move things along. Stomach 36. You probably want to know this one because if I could only pick 1 or 2 points, this one would still be in there. So this one's a little trickier to find. You're going to go, and I'm not going to lift my leg up too high, but find the base of your patella or your kneecap. And that's where you're going to start. Then you're going to take, this is 3 soon. So from the width of these 2 fingers, that's 3 soon. So this was 1, this is 3. You're going to line up your 4 fingers starting at the base of your patella. And then it's 1 finger breath on the outside. Actually, can I get a volunteer up here? It will make more sense. Anybody comfortable? Do you have, are you showing your lower leg? Perfect. Come on up.
Okay. So which one might up here, like this? There's there you go. Okay. Then for the sake of this, I'm going to use mine, but for Sue, it might be different. So the base of her patella. Then we're going to take free seal, starting there. So it's right about here, but then we've got her tibia or her shin bone. Go 1 finger breath outside of that, and it's right there. Another way we can find it is to start a little lower on the outside of the shin bone, come up, and it's like you could close your eyes and just feel it. It just kind of drops. So it's right there. Any questions on that one? No? Okay. So thank you. And back and stomach 30. Yes. So what do you say the other 2 are supposed to go together? If they're in order or
it's harder for acupressure because obviously we only have so many hands, right? Ideally, they go together, but it's not like you do one first or second. It doesn't matter. But if you have either marbles, seeds, acupressure, puncture needles, something, ideally you could do all 4 of those spots here and on the foot web. Was that your question? Stomach 36, you could do on its own or combined. When we're doing acupuncture, I might use 2 needles on somebody and I might use 32. It really depends, but we're being practical for what you can do at home. Heart 7. I love Heart 7. So this spot is amazing for anything mental emotional. So whether somebody is kept awake at night with their thoughts or their dreams, irritability, anxiety, heartbreak, this spot, we can find it from here or from here. There is a tendon right here. It's basically right behind / underneath that tendon. So if you're coming at it from the pinky side, you're going to find the tendon and go just behind it. If you're coming at it from the palm side, you're going to find that tendon and go just, we call it medial, but away from the tendon. So what you could do
is even this. Just kind of pinching that tendon, but the spot is underneath. So just that, it can do this. Don't worry about being perfect. The body's wise. It will figure out what you're doing. Okay. So that is part 7. Yes.
Would carpal tunnel interfere with any?
Interfere with? No, not necessarily. I mean, if it's causing you pain or numbness, then we don't want to aggravate anything, but shouldn't interact. In fact, true acupuncture, not just using some of these points at home, but we can resolve carpal tunnel. But no, it shouldn't make it worse or be a contraindication. So any emotional issue, heart 7 can be your friend. And then Shen Men. If I have a loquacious patient who's very talkative and then they lie on the table and I put in Shen Men, there's no more talking. This is in the lateral. This is kind of wordy, so look at that picture. But it's in the lateral third, so outer third of that upper triangle in the ear. Obviously, for ourselves, it's tricky if you don't know where you're going, so a mirror or looking at pictures online. But that spot is so powerful for calming. When I say if I only use 2 needles, it's usually Shen Men both sides. So that one is where the ear seeds come into play. These little guys, you can alcohol swab, take a tweezers, put it in, and then either press or just, it's already firmly there. You don't want to overstimulate this point because you don't. You just want to use gentle pressure. But if it's like, oh, my anxiety's ramping up, maybe I'm going to get a little squeeze and then do some of this and mix in what you learned. But that's a great spot for ear seeds. Pain anywhere in the body, overall calming, any addictions. So these are just a few resources. Like I said, I am not an expert in oncology, nor am I claiming to be. I'm here in Scottsdale. The next one is neuro-emotional technique, the one we did, the forehead and the stories I shared, practitioners all over the world. Naturopathic Medicine Institute I've been involved in for many years. There are practitioners all over the world as well. Not many, unfortunately, but we are truly root cause medicine focused. And then the last 2 I'm less familiar with, but I talked with some of my friends who are part of these organizations, and they said these were the 2 that they would most recommend in our world.
And what can we do to help use that as like a medical community? What's like a simple thing? I know, it's like
girl, we need to have happy hour. Or a week-long trip together. I like it.
Pilgrimage.
I am ridiculously passionate. I love that you're asking it. My husband works at a hospital. I don't have an answer for you. My husband works in a hospital, and every day I say I would get kicked out. Without a doubt, because my brain gives all of the credit to the body. And I am so far removed from you are a victim to blank, 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 and you can't do anything. And this is just your diagnosis and your BS. It gets me every time I'm talking about the body because in fact, that leads me to my next slide. Your body's ability to heal is so much greater than anyone has ever permitted you to believe. And it chokes me up every time I say it because our society is brainwashed to believe the opposite of this. And it really makes me angry and obviously emotional. So I love that you're asking that. I wish there was an answer short of educating, planting those seeds, watering those seeds, spreading the word. I don't have an answer. But I figure we can only do what we can do. So I don't waste my time or energy thinking about, some of my colleagues, I think, get hung up trying to compare themselves to MDs or practitioners. I don't always get sick, and I have the best job in the world. The body's the most amazing thing to work with. People are beautiful. It doesn't bother me, but yes, that bothers me greatly. And I think back to my mom's journey, and we didn't know. I didn't know what I knew now. And we were in Minnesota. There weren't many options. And it's really aggravating and heartbreaking. And then you add the financial component. I'm cash pay practice. That's not an option for everybody, and I get it. So there's more limited options. Yes.